Hello, this is Dr. Scott Kilberg, the Video Foot Doc, here with another video on all things foot and ankle. Today I'm going to talk about a neuroma. A neuroma is a very common condition, and many of you out there have probably had it. A neuroma is essentially a pinched nerve in the ball of the foot. Symptoms from a neuroma can include things such as a burning sensation in the ball of the foot, or a feeling like you're walking on a pebble, or even a burning pebble for that matter. The pain is generally felt when you're standing and walking for a little while, and then when you get off of your foot and rest and actually begin to rub the area, it feels much better. All a neuroma is essentially is an inflammation of tissue that surrounds one of the nerves that runs inside the ball of the foot. There are several different nerves that run in between the long bones of the foot, each of which have a branch that goes from one toe to another. What can happen for various different reasons is that there can be pressure or irritation to this outer coat, or sort of the sleeve that surrounds these nerves, that can cause that outer coat to sort of swell and begin to thicken up. That thickening will push down on the nerve which lies directly below that, and that will cause irritation. People who have low arches tend to get this condition because there's a group of tissue that goes all the way across the ball of the foot, a group of actual ligaments which connect each bone together. And when your foot flattens out, what will happen is that these ligaments will begin to stretch and push down on the nerve which lies right below that ligament. And essentially that will irritate the outer lining of the nerve itself and create the inflammation. People with high arches tend to get this condition because of the poor shock absorption that comes with having a high arch, and the pressure that is basically absorbed into the ball of the foot, essentially creating the same type of condition. Other symptoms that can also occur with this, because each nerve has a branch that goes to one toe or the other, is a feeling of tingling or burning or even numbness on one side or other of several of the toes, two of them to be exact. Now typically this condition involves the area in between the fourth and the third toe, although it can technically occur in any of these other areas as well. Treatment for this is fairly easy. The first thing you have to do is get rid of the underlying problem which is causing the neuroma in the first place, and that includes supporting a low arched foot or providing more shock absorption to a high arched foot. This is best accomplished with specialty type of inserts that go into the shoe, as well as changing the type of shoes in order to bring more support for a flatter foot or more shock absorption for a higher arched foot. Anti-inflammatory medications and icing also help to reduce the inflammation of the lining of this nerve, as can injections of a material called a corticosteroid, which is basically a cortisone type injection which helps to relieve the inflammation surrounding the nerve itself. Other treatment options that are available in certain areas can also include injection of a diluted alcohol solution, which can kind of cause sort of a scarring of the nerve itself in order to reduce the pain and inflammation. Sometimes surgery is necessary in order to fix this condition. Basically, surgery entails one of several different techniques. The most traditional technique is to actually remove the nerve itself. Now this creates a little bit of some numbness to the ball of the foot as a result of the loss of this nerve, but it generally relieves the pain, and for most people that's more important than having a small patch of numbness on the bottom of the foot. Other techniques can include freezing the nerve in that particular area in order to reduce the pain sensation, and there are other techniques that are also involve doing minimal incision type of procedures to relieve the pressure on the nerve by releasing the ligament that lies over the top of it. Generally, most surgical techniques for this particular condition are fairly successful, but surgery is not always necessary. Sometimes treatment can easily be performed non-surgically and have really good results. Well, I hope you enjoyed watching this video. Look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.